It is the interval between P-wave onset and QRS complex onset. It represents intraatrial or AV nodal conduction. The normal PR interval duration is 0.12 to 0.20 seconds. A short PR interval less than 0.12 seconds is suggestive of facile intraatrial or AV conduction and may represent ventricular pre-excitation. A prolonged PR interval more than 0.20 seconds represent late intraatrial or AV conduction. A varying PR interval is presented in case of conduction block or AV dissociation may be present. AV block is abnormal conduction through atrioventricular node due to delayed conduction in it. Depending of the duration and variability of PR interval, atrioventricular block are named as first-degree AV block, second-degree AV block and third-degree AV block or complete heart block. First-degree AV block features prolonged PR interval more than 0.20 seconds. It is atrioventricular conduction delay. Each P wave follow a QRS complex. It means PR interval is constant, as well as RR interval is also constant. Second-degree AV block characterized by prolonged PR interval, that is atrioventricular conduction delay. Two types of second-degree AV block are recognized. The first one is Morbitz type 1 and second, the Morbitz type 2. Progressive P wave following a non-conducted QRS complex. This typically represent AV conduction block superior to bundle of His. Whereas, in Morbitz type 2, regular P wave follows intermittent non-conducted QRS complex. This is more dangerous as it can progress to high-degree AV block. It is typically present if AV conductions delay after bundle of His. Third-degree AV block or complete heart block have independent atrial and ventricular activity. Here generally atrial rate is faster than ventricular rate.